A very warm greetings from India. And for Indians, it is from Lucknow. I'm Dr. Sunita Singh, presently working as Assistant Professor in Department of Chemistry, Navratanya Mahavidyalaya, Lucknow. And it is indeed a pleasure for me to be part of this fifth International Hybrid Conference on Traditional and Alternative Medicine. And I think this traditional medicine system or alternative medicine system in present scenario is very apt and we can say it is a very engaging topic among the scientific community as well as health professionals because we have seen during this COVID pandemic that where that we have visited our traditional medicine system for a different cure during this COVID, especially different types of kadha, and as well as the use of we can say uh, uh, the use of different breathing exercises, which are mentioned in our uh, yoga literature, which shows that these alternative and traditional medicine system play a very vital role when we talk about this modern medicine system, which is basically on the whole complex, we can say, a nexus of allopathic drugs. And we can't deny that with many of the diseases can't be cured without these drugs. But the side effect is also very the we can see the 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 coverage or the side effect uh, uh, area is very high when we talk about these allopathic drugs. So that's why we are on the scientific community or the health professional community is in the search of minimizing these side effects using different types of complementary medicine system, either it is through Ayurveda or different traditional medicine system, which is mentioned in our literature as well as in China, Japan. We have seen there they are also very rely upon the herbal medicine system. Which are derived from our traditional medicine system. And this and in these type of traditional medicine system or alternative medicine system, aromatherapy comes out as a potential candidate. Although although research support is well required for this area because aromatherapy is basically related to the very elite class, or we can say to a very small percentage, and people think or know about this aromatherapy uh, to only spas and massages, which provide you a relaxing effect or mood lifting effect. But nowadays, people are exfoliating this aromatherapy in different, we can say, in different medicinal system, like which I have chosen a topic as the role of aromatherapy in palliative care. And we all know that uh, palliative care, it is an essential aspect of healthcare, aims to improve the quality of uh, illness by addressing their physical, emotional, and spiritual needs. And in this physical, emotional, and spiritual needs, aromatherapy comes as a very good or supporting candidate because aromatherapy revolves around this, we can say, mindfulness of that body and the emotions related to the when we go through some different type of pains and because drugs are doing their work. But apart from these drugs, sometimes patients or any person need some type of healing that these drugs can't provide. Either it is through family support or through different relaxation techniques, which doesn't fully diminish the pain, but yes, it soothes the pain. And that's why different nursing uh, hospitals are applying this aromatherapy in palliative care. So, what is aromatherapy? I think everyone knows about aromatherapy, but I would like to give a background about aromatherapy because many people are from different backgrounds. So, it is a holistic treatment based on the external use of essential aromatic plant oils to promote, to maintain physical, physiological, spiritual well. These parameters are also taken care in palliative care. These is physical, physiological, spiritual well. It is a part of herbal medicine and one of the fastest growing fields in the alternative medicine. It is used for the relief of pain, reduce anxiety, and promote relaxation. We all know about essential oils. Essential oils are the exudation of different extracts or fluid or liquid from the plant sources, and they contain volatile as well as non-volatile fractions, and their chemical composition is having different variations starting from 2 to 400 components in a single plant essential oil, and each component plays a very vital role to provide their therapeutic properties. History of aromatherapy, when we see in the literature, it is around 6,000 years old, and it is firstly used in Greece, Rome, and Egypt, where they use different types of, we can say, balming-like thing for we can say preserving bodies as well. And Hippocrates, the father of modern medicine, also mentioned about this aromatherapy. In modern era, the term is coined in 1928 from the French term aromatherapy by a French chemist, René Maurice Catafosse. It is discovered for the healing properties of essential plant oils. Although at that time, or the essential oils are not very well known or not known for their therapeutic properties. Yeah, but they use these type of extracts for curing different type of diseases. And as slowly with the technological advancements, scientific community paid attention to these therapeutic properties, and they did work on different essential oils for different biological properties, either it is anti-inflammatory, antimicrobial, antioxidant, anti-cancerous, anti-ulcer, anti-inflammatory containing uh, because uh, the origin plays a very vital role. We know that the naturally occurred product has a has a positive, or we can say a plus point in comparison to the synthetic ones. And in today's also having so much advancement, 85% of the population rely on the herbal medicine system. From especially in India, we see like different type of spices or different types of herbs are used for treating cough or stomach problems or gastric problems, because somewhere it shows the positive effects without without giving any side effects or having very less or say negative effects. Uh, when we see in COVID era, we see a kadha made up of basil leaves and black pepper. So these evidences prove that our herbal medicine system is very strong, and we need more clinical research for knowing the benefits of these herbal plants. And it is also mentioned in World War Second and First that by these essential oils has been used for their healing properties by Dr. Jean Walnut. Benefits of aromatherapy, starting from sage, rosemary, lavender, rose, peppermint, lemon, orange, cucumber, cinnamon, star anise, eucalyptus, chamomile, vanilla, and jasmine tea tree. So these are some of the commonly used essential oils. Uh, and these essential oils can be obtained from the leaves or flower part or the bark part or the fruit part. So they can be extracted from the different parts of the plant. And it includes like I have listed some of the essential oil and their benefits, especially when we talk about in their role in aromatherapy. Like lavender have calming effect. It reduces anxiety, aids in sleep, it is a pain reliever and has antiseptic properties. Tea tree oil has antiseptic, antimicrobial, antifungal properties. Peppermint relieves in nausea, muscular aches, migraines. Eucalyptus used as decongestant, expectorant, beneficial for cold and flu. And lemon, it has antimicrobial, antioxidant properties as well as it helps in uplifting your mood. It is an anti-stress as well as immune enhancing property. So these are some of the general benefits of these commonly used essential oils. Different methods of aromatherapy has been applied for providing their beneficial effect. Either it is through inhalation, it is or either through oral intake, or it is either through topical absorption. In inhalation, it takes place through the respiratory tract. In oral intake, it is used in the form of capsules, drops, or food, and in topical absorption, which is through the skin. So these are the commonly used method that has been applied in aromatherapy. Uh, Aromatherapy, we can say when we talk about aromatherapy role in palliative care, it is a fragrant quest for relief because it is a globally recognized therapy. It is a complementary and integrative medicine usage which is rising worldwide, particularly among cancer and palliative care patients. Uh, Although the clinical evidences are low in number, but yeah, it remains a popular choice for patients and their families because somewhere everyone knows that something coming from nature has or should have positive effects. The advanced disease symptoms significantly affect quality of life. So people attract towards these complementary and integrative medicine system to provide to provide relief from different symptoms. And aromatherapy is embraced across various cultures and often used alongside with conventional treatment. Yeah, we can say that the acceptance for this aromatherapy is much more than other any complementary or integrated medicine system or therapy. Palliative care, as I have already told, that it is a specialized medical care focused on providing relief from the symptoms and stress of a serious illness, aiming to improve quality of life for both the patient and the family. They used to manage different types of symptoms. We can't say that internally, but yeah, physiological system or the symptoms or the spiritual needs that a patient want. Like aromatherapy is used in palliative care to help or manage the symptoms such as nausea, anxiety, and pain, enhancing the patient's comfort and well-being. It supports the holistic approach of palliative care by addressing physical, physiological, and spiritual needs through the use of essential oils. Um, Aromatherapy is treated or considered as a complementary therapy that can be used alongside conventional medical treatments to help or alleviate various symptoms. Studies have shown that aromatherapy can have positive effects against nausea and vomiting in advanced cancer patients receiving palliative care. As we know that this is we are living in an era where everything has to be supported by clinical trials or proper documentation of that work. In that case, we can say that aromatherapy results are lacking. Yeah, we know about aromatherapy and people talk about very much about this aromatherapy, but when it comes to the result, how they work or what positive results they have supplied. So that data is very less. And in that area, scientific community or the aromatic professionals or the aromatherapy professionals has to work. But some of the data which shows the different analysis done using this aromatherapy, I have tried to compile it. like lemon oil pads have been used, in which a retrospective analysis at the University Hospital Krems evaluated the use of lemon oil pads against nausea and vomiting in advanced cancer patients. The study found that lemon oil pads provided adequate relief for nausea and vomiting in 73% of the application. In one of the qualitative studies, a systematic review of 5 qualitative studies indicated that patients with advanced cancers benefit from aromatherapy, experiencing increased well-being, recovery, and distraction from their illnesses. So we can see that this aromatherapy work on the emotional, we can say, infrastructure of that person, emotional management. Uh, we can say palliative care is dealing with the is dealing with the is go with the holistic approach, and it doesn't matter, it doesn't provide the direct result like the drugs, but yeah, it provides the inner healing through aromatherapy. uh, one another large systemic review encompassing 22 trials with 1956 participants, which assessed the effectiveness of aromatherapy, massage, and reflexology in palliative care patients. This review provided evidence supporting the benefits of these therapies in palliative care settings. These studies collectively suggest that aromatherapy can be an effective complementary therapy in palliative care, particularly for symptom management in advanced cancer patients. Yeah, because we know that cancer is still a very, we can say, uh, dangerous as well as a painful disease. And apart from the drug side effects, also people gets very disheartened or gets in a very depressed mode. And this type of therapy, aromatherapy, provides that a positive streak in their life. Like mood upliftment is also like one of the we can say results of this aromatherapy. People feel the feel good factor also play a very vital role in recovering. We can't say aromatherapy can cure any cancer disease, but yeah, but they this therapy has a you can say has a potential to distract the person from this illness and the pain which he or she undergoes. So these aromatherapy work on the emotional level as well as the spiritual level also. Yeah, we have very positive notion about this aromatherapy. Yeah, but still there are also challenges with this aromatherapy, like regulatory challenges. It is one of the most important challenge. It establishing standards and certification requirements for aromatherapy practices and products. Safety and efficacy is also one of the major issues, like ensuring the safety and efficacy of essential oil used in aromatherapy, which can vary widely in quality and composition. Proper training of healthcare professionals, providing adequate training to uh, healthcare professionals in the use of aromatherapy within clinical settings. And more research and evidences are needed to build a robust body of scientific evidence to support the therapeutic claims of aromatherapy. Cultural acceptance, overcoming this skepticism and resistance within the medical community and among patients accustomed to conventional treatments. We have seen recently in one of the cases how things were manipulated, or we can say a negative mindset was developed for the Ayurveda in one of the case in India. But yes, people have to change or accept other therapies also. Integration with the conventional treatments, determining appropriate protocols for combining aromatherapy with other medical treatments and interventions. Quality control, standardizing the production of and distribution of essential oils to ensure consistent quality and therapeutic value. Environmental and sustainability concerns, addressing the environmental impact of sourcing and producing essential oil as well as ensuring sustainable practices. So these are some of the we can say challenges in aromatherapy and how it can be integrated with palliative care or any other conventional treatments. And these are some of the references for this work. And I hope I am able to convey my message of point to all of you. Uh, I would like to congratulate Conference Mind for this wonderful conference. I have seen the schedule and different topics that has to be discussed or that has to be uh, illustrated in this conference. And all my wishes with the conference mind and organizers. And if anyone has any type of query, they can get my email from the organizers. And once again, thanks for giving me this opportunity to be part of this international conference. And I hope I have given a picture about aromatherapy and palliative care. So thank you very much.